And welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin, and with me is my wonderful patient Shannon, who we recently completed her upper full arch restoration with mini implants. How are you doing this morning, Shannon?
I'm good, thank you. Thank you for having me.
It's great to have you here. Shannon, tell us a little bit about your dental history and what's happened to you over the years and why you ended up coming to me to have your mini implants done.
So about 14 years ago, when I initially had gotten pregnant, I noticed some of my teeth were just not as strong as they once were, and there was a lot of decay. I was getting cavities really easily, and as the years progressed and I had another child, my teeth would start breaking off and just falling off it, but the root still being intact. It was so painful. I had so much infection, constant headaches and stomach aches. It was a long haul.
Do you remember as a child having dental problems or,
Nope.
or cavities, or did you eat a lot of sweets growing up or
Nope,
anything like that?
I had good teeth.
Your teeth were good.
Yep.
That's interesting. And your bottom teeth are fine
Yeah.
right now, right?
Yep.
It was really the upper teeth
The
that
upper
went
teeth,
bad.
yeah.
And how many children do you have?
I have 2 daughters,
How old are they?
12 and 10.
All right. So this all kind of started around the time you became pregnant with your
Yeah.
first child.
Yep.
And, you know, there is some theory that pregnancy can suck the calcium out of women and can weaken their bones and stuff. But you had kind of a dramatic situation where your teeth really went bad pretty quickly over
Yeah.
a short period
Yeah.
of time.
Yep.
So, and then you also mentioned to me that you had a dog that bumped your tooth.
Yeah, my front tooth got knocked out. It was a couple months before I had actually come to see you. So I was without a front tooth for at least 2 months, and it was awful.
But you were having lots of dental infections
Yes.
and toothaches. And
Constant. I had a headache every day for months.
Really?
Yeah.
I wonder if your sinuses were involved with some of the infection, because that can cause headaches.
Yeah.
So tell me how you heard about me.
So I had been doing my own research for how I wanted to handle my dental situation for a couple of years. And I came across this girl whose cousin had come to see you, and they were like, I really think you should watch her videos.
Princess Glitterhead?
Princess Glitterhead.
All right, Princess Glitterhead, or Alicia,
Yep.
who's a good friend, has her websites and her YouTube videos and TikTok videos.
Yep. So I found her YouTube and I endlessly watched her videos, and then I looked you up for my own, did my own reading, and it took me a few weeks, and I was like, okay, I think I'm comfortable enough to reach out. I feel like this is something that I can do with this guy, and I feel like he's got the credibility where I'm okay with it. So I reached out to you, and it was real fast that you reached back out and got me in.
Yeah, so tell me about your experience with what you've had done here.
I was literally just telling someone the other day that it was one of the best experiences that I've ever had at a dentist office. I'm one that's terrified of going to the dentist, but this was one of the best situations I could have ever put myself in. The staff was so friendly. The bedside manner was amazing. It was so fast and painless, and that was my biggest concern. I was like, I'm gonna be in pain for weeks, and it was remarkable.
I'm so glad you had a great experience. Did we do the original consultation by Zoom?
Yes.
A Zoom consultation?
Yes.
You know, so for those of you who don't know, but when COVID started happening several years ago, we had to close down our dental offices, and we could only see patients with dental emergencies. So I started doing virtual consultations by video, you know, FaceTime or Zoom consultations. And it really worked well because you could actually spend more time communicating with the patients that way and have a lot of time to answer their questions and things like that. So I guess that's how we met by Zoom.
Yep.
You must have sent in a request for a consultation.
Yep.
And then we did that. And then, of course, you live about an hour and a half.
About an hour and a half away.
So you came in for the final consultation then to start the work.
Yep.
All right, great. And when did we finish your work?
It was I came in 2 weeks ago for my final impression, but my work was complete, I want to say in January, late January.
I think so.
Yeah.
So in your mouth now, is this the final restoration, or?
I'm actually
We're putting it
getting
in
my
today.
final set today, and
That's what
I'm
I
so
thought.
excited.
All right, well, your temporaries look amazing.
They're fantastic.
So hopefully your finals will look just as beautiful, and we can have a short talk after we put your permanent teeth in just a little while.
Absolutely.
All right, well, thank you so much for joining us. And I wanted to mention that, Shannon, every year I choose one patient to participate in our Make a Smile Happen program. You were that patient, and I don't know if I shared that with you or not, but your dental work that we did, I did it at a significantly reduced price for you, and I know you got help from a friend who came to bat for you to help you financially for this. And I wanted to do my part in that too, so we gave you like a 30% discount on the work.
And I'm forever grateful for that.
Yeah,
I'm
so-
very appreciative.
So let's go ahead and try your new teeth in
All
and
right.
see how they look, okay?
Okay.
All right, great. We'll be back in just a minute on the Monday Morning Minute. All right, so here's our zirconia roundhouse bridge. We're going to try that in and see how it looks, and then we'll let her take a peek at it. Close very gently. Smile big. They look really nice. Very nice.
Wow. They're beautiful.
Aren't they pretty?
Yeah.
You go right up to your gum line.
That's amazing. Those are gorgeous.
Yeah, they're
Wow.
gonna be beautiful. And of course, we have a few teeth to put on the bottom too. We did implants here, and I haven't told you yet, but I'm gonna do these for you for free too.
Thank you.
So we're gonna get this all done, and then we're gonna get you an appointment to replace the bottom molars.
Thank you.
Okay? It's all part of the Make a Smile Happen program. We're gonna help you. This looks fantastic. Really, really nice. One little spot here, a little bit of tissue irritation. Can you give me some Hibanex, please? So this is a great product that we use from Shatkin F.I.R.S.T. It's called Hibanex, and it really works well. It's an antibacterial product, and it helps to reduce the inflammation. I'm gonna go suction here before it goes on your throat, please. And you'll literally see before your own eyes the tissue go from red to pink. What it does is it sucks out all the bacteria like an astringent, and it just turns it from red to pink and healthy. It's amazing. It's an amazing product. Okay, so let's take off the bottom temporary. We've just got 2 molars on the bottom here, or a molar in the bicuspid, right? Sorry about that. I know that's not fun. I apologize. Almost done here. Okay, there it is. There's a couple pieces here. Okay. Okay, so we have 2 molars, number 18 and 19, that we're replacing. So those look great. Let's see, we have the bridge back again. Let me just check the bite with that in. Close together. Okay, that's great. Okay. All right, open. What I'm going to do is I'm going to cement the bottom teeth first, okay? Mm-hmm. Those implants look great. Let me just tap on those. Yep, they're doing good. There's a little bit of cement there. Okay. So we're going to cement these with the Shatkin F.I.R.S.T. resin cement. There's a bridge. Did you take this out?
You did.
Okay. All right, close together and just hold that for a couple minutes, okay?
Mm-hmm.
All right, open and bite. And we're gonna do some adjustment of the bite when we get it all done here. Okay, open. And bite gently. Open. Have some articulating paper. Close together gently. Open. Close. Okay, this canine is getting a little heavy here. Let me see. Bite gently. Open and bite. Open. Hold the lip down. I'm just going to even up your bottom teeth just a little, okay?
Okay.
Bite together again. Open and bite. Okay, we're going to do a little fine tuning of the bite. Okay. Let me take this out. Open for me. I'm sorry, I'm just cleaning the cement. Just making sure we get all the cement out. There we go. A little bit more here. Sorry, I'm poking your gum a little bit. I'm sorry, there's a little bit of cement under there. I'm just making sure I'm getting it all out. Okay, I think I got it. Piece of floss, please. Let me just see here. A little space there, but it should be okay. Okay, let's see. All right, so we're going to put this back in, let her look one more time, make sure she's happy, and then we'll have her sign the consent to cement this. Okay, bite together. All right, just take a quick look and make sure you like everything before we cement it, okay?
Yeah. Now, once you cement it, how will I like clean underneath
You're going to
it?
use a water pick and an electric toothbrush that we're going to give to you.
Okay.
You don't floss under it, it's all one piece, but you
Okay.
use a water pick every day and an electric toothbrush, and we're going to give that to you at the end here.
Okay.
So I can cement this with temporary cement, and I can have you come back and because we're going to have to do this bottom anyway, so we
Yeah.
could put in with temporary cement for you to try it for the next week or two.
Okay.
Make sure everything's perfect, and then we can take it out and put it in permanently if you want, or we could put it in permanently today. It's all up to you. But I feel like maybe just give it a try for a couple
Yeah,
weeks.
I think so too. And
Make
then
sure, okay?
yeah, let's
All right,
do
so we'll do that with temporary cement, okay? Make a note that we explained to her that it's temporary cement, okay? All right, so we're using, I really like this product from Ivoclar. It's called Telio Link. It's very nice temporary resin cement, and it's easy to get the teeth out when they're in with that material. So have it bite together and just hold that gently, okay? Just like that. So the Telio is light cure, dual cure, so we're putting the light on it to cure it a little bit. Okay. Close gently. Is that pretty good? Let's see. Bite gently. Bite again. It's hitting on the left side too much here. Close again. Close. Open. Close again. Might be a little cold on these bottom teeth. Close again. Open, close. My Ring doorbell's going off, sorry. Bite together again. Bite again. That feeling better?
Yeah.
Open and bite. And bite again. That's much better. Let's see. Open and bite. Open. I'm sorry. Bite together again. Wait, just a tiny bit more. Bite again. And bite. Open. Bite. Open. Bite. Bite. And bite again. I think we're pretty good now. Bite. All right, excellent. That's much better. Does that feel good?
Feels better, yeah.
Okay. You clean the cement yet?
Right.
Is there anything to clean? Let's see. There may not be much of anything. A little bit here. That looks amazing. You want to bring your husband in to see? All right, what's his first name again?
Jesse.
Hey.
You look awesome.
Aren't they beautiful?
Yes, they are. How do they feel?
So good.
Better than the other ones?
Way better.
Yeah.
They're so natural feeling.
We were just talking about it on the way here about how good those ones felt. Just from step 1 to 3.
Yeah. Yeah, no, they feel awesome. It's crazy.
Hey, you look gorgeous.
Thank you for helping her out. I
They look
appreciate it.
amazing.
It's been a long time coming.
Well, I told her, I don't know if she told you, but as part of the Make a Smile Happen program, I agreed to do these bottom left teeth for her
Yeah.
at no charge, but I'm going to do the other side for her
Oh, that's
too.
awesome.
And she's such a trooper and she's a great patient, and I really appreciate it. We're going to make her smile. That's the whole idea. Make
Yep.
a smile happen.
So, tell you what we'll do. Let's take impressions and we'll have first crowns made for the bottom right side. So next time she comes in, we can put the implants and the crowns in. Okay. And then we'll cement the upper permanently, okay? So we'll take upper and lower impressions and a bite. Okay, we can do the bite now and then we'll do it as a first technique so we can put the implant. We'll have a surgical guide stent made and we'll do it all in one stage. Let's see. I'm just gonna take a little bite here. Go ahead and bite together and just hold it. Hold it like that for 30 seconds, okay?
I'm just taking a small posterior
Okay.
impression for this
Is
stuff.
that what you want to do? Okay.
Yeah, that's what I usually do.
Is there enough? Okay. Well, that should be good then. If you got, oh, you did an extended one, right?
Yeah.
Okay, that'll be fine. Then you don't need the full arch.
Yeah. I think if it's just a small.
Okay, sure. So we're gonna have a surgical guide stent made and crowns on the right side for the next time she comes. And at that time, we'll check the upper, and if everything feels great, then we'll cement the upper permanently. It's in with temporary cement. Bottom left is cemented permanently already. Okay, open. Oh yeah, that should be good. Okay, no problem. And you'll send the x-ray over to them, right?
Yep.
Okay, bite together. Feels good?
Mm-hmm.
Fantastic. Okay, and make sure we give her the bag.
Yes. Okay.
Let me, here, will you hand me that, Jess?
Yeah.
Got a lot of stuff in there.
So
Bag.
we give all of our patients an electric toothbrush and a water pick so that they maintain their teeth really, really well. And then we have them come back every 3 months for checkups and cleanings. So we'll take care of that. Okay, so here, this is important for you to use all of this. I'll give it to your husband, okay?
All right.
All right, very good.
Perfect.
That's right.
You can see the upper implants here. All right, those are all the implants. And on the bottom, we put, and you see the lingual fossa was very close. We had to angle those and just stay above the lingual fossa. And we were real good. Everything looks perfect. And then we're gonna do the right side next time. All right, Shannon, so you've got your beautiful new teeth in your mouth. How do they feel?
They feel so good. They're so much lighter and natural feeling.
Yeah, the temporaries are a little thicker because they're made of plastic.
Yep.
And these are, of course, zirconia porcelain.
They feel perfect.
Smile big for the camera. And you brought your husband here today, Jesse, right?
Yes.
Yep.
Jesse, come on over here. What do you think about your beautiful wife's new teeth?
Even more beautiful than before. I didn't think it
How
had-
could she be?
I don't know. But you did a great job. They look really natural, and I'm so happy that we found you. She found you, and
Yeah, well,
we're able to help
it's
out.
my pleasure to help. And as I informed you guys earlier, we had done the lower left side for her at no cost to her because I wanted to help even further than what the discount we offered. But now we're going to go ahead and do the bottom right side as well for her at the next visit. So you're going to have a full set of teeth, and you're going to be able to eat whatever you want.
I can't wait. I'm so excited.
I'm happy for you.
I'm so grateful for you. Thank you
It's
so
my
much.
pleasure.
I really appreciate
We'll see you in a couple weeks.
Yes,
Take
I'll
care of
see
the
you
bottom,
soon.
okay?
I really do
All right.
appreciate it.
Thank
Thanks,
you.
guys. I encourage all of you to go out and make a smile happen in your community. You know Shatkin F.I.R.S.T developed this about 10 years ago, and we will help you by providing you with up to $1,000 in dental implants and lab work for your patient's case at no charge. All we ask that you do is carry that forward to your patient and give them a significant discount or whatever you feel comfortable doing for your patient in your community. So I encourage you to to use the M.A.S.H program, the Make a Smile Happen. If you have a patient who's a victim of domestic abuse or had cancer or had dental problems that they couldn't control, or an accident or an injury, and you want to help that person out, or maybe they're just somebody that just doesn't have the money to get their teeth fixed, we encourage you to participate in the M.A.S.H program. You can choose one patient every year in your practice. All you need to do is send in to Mark Ahrens, our marketing director, a little letter about the patient and why you think that they're a candidate for the Make a Smile Happen program. I encourage you to participate. It's a great way to give back in your community and do something nice, and you'll feel good about it, and so will your staff. Thanks for joining us on this Monday Morning Minute. I look forward to seeing you next week.
Join Dr. Todd Shatkin and Dr. Gordon Christensen for our 3-day advanced mini dental implant course on March 27th through the 29th here at our headquarters in Buffalo, New York. Watch Dr. Shatkin do live surgery while earning up to 24 CE credits. Spaces are limited, so sign up at ShatkinF1RST.com today.